You tried the little blue pill and it didn't work. Now what? I'm Dr. Mina Malik, urologist and pelvic surgeon. And today we're going to talk about how you can take these medications like Sildenafil and Tadalafil so that they work every single time. Let's start with the basics. When a man is aroused, his body releases a chemical called nitric oxide, or NO. When the body senses this NO, it triggers the production of yet another chemical called cyclic guanosine monophosphate, or cGMP. Now, this relaxes the blood vessels in the penis, allowing blood to flow into the penis and engorge the erectile bodies, and this causes an erection. Now, in erectile dysfunction, men who have ED, they have a certain enzyme called phosphodiesterase 5, which then breaks down that cGMP too quickly. This then quickly reduces blood flow to the penis, making it difficult to achieve an erection or even maintain an erection that you've already gotten. And so medications like Sildenafil or Tadalafil, also known as Viagra or Cialis, are PDE5 inhibitors, and they block the action of PDE5. This then allows that cGMP to build up and stay in the system longer. This keeps the blood vessels open and relaxed, with blood flowing into the penis and remaining into the penis longer, allowing you to have an erection and maintain it for the purposes of intercourse. However, many people will try these medications and they might not have success the first time, and then they give up. So what makes it more likely that you will have success, that you will optimize your response to Sildenafil? Number one, don't give up. If it doesn't work the first time, try again and again. I know this sounds simple, right? Why would it be any different after the first time? Well, in fact, they've looked at this in a study, and they looked at 1,276 men who had erectile dysfunction, and they were enrolled in what we call a double-blind, placebo-controlled trial, multiple studies actually, between the years of 1996 and 1998. And they looked at what happens when they took Sildenafil, if they had sexual stimulation, and if they had successful intercourse. So what they found was that on the first and second instance of using Sildenafil, the medication, only about 54%, half, and 64% on the second try were able to have successful intercourse. However, by the 8th time they tried using Sildenafil, 86% of people achieved success. So what that tells me is that, the first time you use it, you might be nervous, you might be anxious, you might get it wrong in terms of timing, you might eat too much, whatever. There's a whole bunch of reasons that can affect your ability to use Sildenafil appropriately. And as you get more comfortable using it, your stress level goes down and you're able to then get an erection. Stress is an erection killer. So let's move on to the next thing. Second is increase the dose. Very often when you're prescribed these medications, your primary doctor or even some of these online companies that give erectile dysfunction medications will start you on a lower dose of these medications. And often there are higher doses available. In fact, in a study that looked at 137 men who had been referred to urology for quote unquote unsuccessful treatment with Sildenafil, about half of those, 55%, had only been given 50 milligram doses. Now, Sildenafil goes up to 100 milligrams. So these men who then came to the urology clinic were educated on how to use it, increased their dose, and 54% of the men who were considered unsuccessful with Sildenafil eventually became successful after receiving proper education and appropriate dosing. Number 3, take it the right way. Now, you might be wondering, what do I even mean the right way? Well, you basically just put it in your mouth and swallow it, right? That's the right way. Well, Well, not exactly. So there's a few things that have to happen for you to get the desired result, meaning get an erection. And first off is sexual stimulation. Sexual stimulation is necessary for the medication to work. It's not just going to give you a random erection because you took a pill. You need to hear something, see something, feel something, even smell something that is arousing to you, that turns you on to begin that release of nitric oxide that we talked about. You need to take the medication at least 30 to 60 minutes before sexual activity, but up to 4 hours before. So these medications take some time. They need to be absorbed into the bloodstream. They need to be broken down into their active form, and they need to start working. So when you take it 30 to 60 minutes before sex, that allows enough time for all these things to happen. Essentially, it's going to get absorbed in the bloodstream, which can take about 30 minutes. Then it's going to be broken down into its active form, which occurs in the liver. That takes another 15 to 30 minutes, and then it will start blocking PDE5 and allow that cGMP to build up. So about another 15 to 30 minutes. That's where the timing comes from, 30 to 60 minutes. So typically the medication is at its peak effectiveness at around 1 hour. And if it doesn't always work out to take it 30 to 60 minutes before, you can even take it 2 to 4 hours before. It's not always something that it has to be perfectly timed, but there has to be enough time for that action to occur so that it starts working. Next, avoid high-fat meals. Now, high-fat meals can slow down the absorption of sildenafil into the bloodstream. Now, this is because fat takes longer to digest than other nutrients that you eat, and it can then subsequently delay the release of sildenafil from the stomach into the bloodstream. If you take sildenafil with a high-fat meal, it might take one longer for the medication to start working, or it might not work at all. And so you might still even get the side effects associated with sildenafil, but not the actual effects you want. Generally, I also recommend avoiding excessive alcohol use because sometimes that can make it more challenging to get an erection. I've talked about whiskey dick in a previous video, so check that out. Lastly, improve your overall health. Now, this is the one thing most people don't appreciate. Erectile dysfunction happens most commonly because of things like vascular dysfunction. So anything that affects blood flow. So that's things like diabetes, high blood pressure, high cholesterol. And I can't tell you the number of times where I've found diabetes, high cholesterol, or high blood pressure when they just came to see me for ED. In fact, when they did a study of 521 men with erectile dysfunction who were counseled and treated to optimize their other lifestyle factors, they then had a success rate of 82% while taking sildenafil. Obviously, that's because their blood vessels are now more healthy. Now, in this study, how do they optimize their health? They checked their medications to make sure they weren't on any medications that would interfere with erections. For example, men who were on metoprolol or propranolol for high blood pressure were replaced with medications like atenolol, which don't have as much of a side effect with sexual dysfunction. And if they had high blood pressure or high cholesterol, they were then put on medications to treat those issues. And obviously, if they were smoking, they were encouraged to stop smoking or at least reduce their cigarette intake. If you guys didn't already know, cigarettes are erection killers. So you absolutely have to quit smoking if you want to maintain your erections. They were also counseled in the study to limit their alcohol intake to 1 drink per day on the days that they took sildenafil and up to 2 drinks per day on other days. Obviously, the recommendation is to drink less than 7 drinks in a week, ideally. They also had a hormonal assessment. If they found that their testosterone levels were below age-appropriate levels, patients were then treated to increase their testosterone to normal levels. Lastly, bring up your issues to your doctor. Now, I realize this is difficult. Talking about sex is difficult. Talking about issues you're having is difficult. But if you want to have success with medications and it's not working, make sure you review this with your doctor. Because unfortunately, sometimes they might not even think to bring it up. In a survey of 1,600 primary care physicians, only 45% routinely ask their patients about ED symptoms. So a lot of people are not getting getting these questions asked. And as I mentioned earlier, I see lots of people coming in with low doses of sildenafil or tadalafil, and they never even knew that there were higher doses available to them. So it could be as simple as asking your doctor for a higher dose, or maybe to try tadalafil instead of sildenafil, or an alternative option. Bottom line, don't get discouraged if it doesn't work perfectly the first time. Give it a solid college try, meaning try it at least 8 times, and bring it up to your doctor. And don't hesitate to ask questions. Ask if there's a higher dose, if there's other alternatives, if you could be referred to a specialist if they don't have anything else to offer you. Okay, guys, before you leave, I just want to make sure that you are all following me on your favorite podcast platform, whether that's Apple, Spotify, Overcast, whatever it is. Make sure you find my podcast. It's the Rena Malik MD podcast, and I cover many topics in significant detail, have experts on each and every week. Obviously, the videos are here on my YouTube channel as well, but sometimes, honestly, we don't have an hour to sit down and watch a video, but you can absolutely listen to me on your commute or while you're out for a walk and still learn all this wonderful educational content. So do me a favor and subscribe or follow or whatever it is on that particular platform. Leave me a rating or review if you're liking the content, because that helps other people find my content as well. And as always, remember to take care of yourself, because you are worth it.